can't have a birthday party without a birthday cake.
He's gonna let you know.
Okay. Well, I'm just gonna sit down here.
Go back to that item. We have a 3-minute time limit. I'm going to set the time.
Sure.
So go ahead, sir.
All right, so I came before you guys over at the other side back in January, and I gave you guys my experience relative to the vaccine. My mom got it. 5 days later, she had a stroke. The doctors at the hospital wouldn't acknowledge that she had just been vaccinated 5 days prior. They wouldn't write the word vaccine in her chart. Okay, and that was a concern to me, obviously, as a biologist. You don't dismiss the most likely proximate cause prior to the investigation, but they didn't report it to VAERS either. And if our experience is anywhere like everybody else's experience, which it probably is, that means we probably don't have accurate reported data. And so that was the concern that I presented to this body back in January is, I'm not sure that the CDC is as trustworthy as we can be placing our public health decisions on. They were reported to have been directed by rogue interests, misrepresented data regarding the Wise Women's Project to Congress in 2016, which was reported by their own scientists. And that's not been addressed to this day. Okay, so how we're blindly trusting their data when we've got reports from the Agency for Healthcare Research Quality saying that they're getting 1% of these things reported. There was a machine counting system that was created. The CDC stopped answering the phone calls of the Agency for Healthcare Research Quality. It's a big deal. My mom had a stroke 5 days after. We had this just unusual experience where we were vilified for even implying that it might have something to do with the vaccine. And so I understand that this is not a comfortable subject for people, but this is something that I would like to follow up with at least one of y'all. I gave everybody my business card. So I would like maybe an email back to see what, if anything, y'all have done to address that, all right? Appreciate you guys' time. Thanks for everything y'all do.
I will. Thank you for being here.
Thank you, guys. Pardon? Thank you. She's okay, thank God.
In Denton County, we have a couple of details about reporting of adverse events. Number one, there is a national registry where providers and actually any consumer can report an adverse event from a vaccine. That's collected by the CDC. That's public record, and they actually publish those reports by state.
So I'm just going to cut him off there for 1 second. When the consumer reports it, and you'll hear me say this again in the conversation in just a minute, but when the consumer reports it, it's a lot less legitimate. And then, after the fact, people like him can come back in and say, oh, well, these are just red arms and soreness, and anybody can report that.
We tried to report it through the hospital, and they refused. Then people like you claim anyone can report and shame victims as liars.
Why there's so many reports. No, there are thousands of people who have suffered life-changing injuries.
People in danger.
Help share our stories. Help our voices be heard. Help us bring together the medical community so we can receive the help we so desperately need. We are real.
We are real.
We are here.
We are here.
And we want our lives back. We are real, not rare.
Hashtag real, not rare. Hashtag real, not rare.
1 in 40 is what the Agency for Healthcare Research Quality said. These are the regulators. If they're not getting it right, then that's a problem. And we've got to address that at a societal level. Otherwise, we're in danger. And what has happened will happen again. As soon as they get the guns, we have no choice. Or show up to the polls with me. With someone who will fight for you, that doesn't have to say, I have to hide behind some political ally, because I don't and I won't, and that's proven.
And you can find that on their website. So that's one detail. I would also note that in Denton County, we do get reports of those adverse events, but particularly not in this case with stroke, but with mortality, we actually do track a vaccine record. So this is just a reminder of sort of this data analysis. We do track a vaccine record and a symptom of COVID. Those are two prerequisites for the reporting of a death. So our numbers actually are lower than in Denton County from the CDC in accounting. Again, this is for death, because the CDC will just take a physician notation on a death certificate, and we require a higher level of verification. So our verification is note of a vaccine or lack of a vaccine, depending on the COVID death, obviously, and then a symptom of the disease. And so just wanted to highlight the Denton County, our epidemiologists do, again, for the mortality, we do investigate every reported case. When it comes to adverse events, we partner with the CDC if asked on those adverse events, but we do not investigate every report. The adverse events can include soreness and redness at the site of injection. Some people do report that, and so, as you can imagine, those adverse events technically count, and there are thousands of those. Very, very, very few have an association with stroke or heart. It's not impossible. Myocarditis obviously was something that was noted. So just letting you know that we do have our epidemiology teams and do have that data that we review, typically for mortality, but when it comes to adverse events, we partner with the CDC on that, and that is public record.
Okay, thank you. I think it's important to note.
Judge, might I have an opportunity to respond just real quick? 30 seconds.
No, sir, we've already used the 3 minutes, but we'll be happy to continue the dialogue with you. I noticed Dawn gave you her card. I know Dr. Richards will be here today.
Fair enough. Thank you, sir.
How are you? My name is Matt Richardson. So
3,736 strokes within 15 days for Texas Medicare recipients alone. So that's not very few.
So
13% of those died.
Sure. There's a statistical statistical concept at play. So I don't know if you're able to. You tell me if you want to have this discussion.
I absolutely can.
I'm actually a stroke survivor. I had a massive stroke in 2015. So I'm sensitive.
Okay.
Right?
All right.
I'm sensitive. So I think I would.
Maybe we
just
should
note-
go down. So
Yeah.
we're not distracted.
Yeah. I would note you mentioned Medicare recipients.
Right.
So there's an ascertainment bias issue at play
I get it.
when we talk about Medicare. So I think you get that stroke, heart disease, these are some of the concerns.
Sure.
So you said you're a biologist?
Yeah. I get Bachelor of Science from UNT.
Okay. So you know about mRNA and how
Absolutely.
messenger RNA works in the cells.
I do.
So
So why was CRISPR never used in humans before this? I had questions about it from the beginning, and then my worst nightmare came true when my mom went ahead and rolled up her sleeve, was one of the first ones out the door, and went to the Speedway, and this happened, and we were treated like demons for even mentioning it.
Yeah.
And that is just, that's odd. Okay,
Yeah.
that's an abnormal. And so the only thing I was going to say is when I have to report it, it delegitimizes it having been reported at all, as opposed to a doctor reported it because he's the one that treated her.
Right.
And so there's a couple of things that don't make sense relative to the way
did she have other risk factors for stroke?
I mean, yeah, she's 75. Okay.
Sure.
But again, there's nothing like this that had ever happened.
Well, help me.
And then 5
help me
days after the
understand.
vaccine.
Because again,
It
you're a
happens.
scientist, so I'm interested.
Sure.
How do you how do you combat confirmation bias?
Well, how do you account for Pfizer changing it to where they recommended based on relative risk as opposed to absolute risk reduction? Why was that what was considered unethical up to COVID? Why was that all of a sudden the standard by which reporting happened?
I think it was both.
It has
it was both.
It has to be both, but that 95% effective claim that was being made wasn't it.
Vaccine efficacy was declared at 95%, but Dr. Malhotra argues that the methodology was flawed.
Relative risk reduction is a way of exaggerating the benefits of any intervention, clearly which would be in the interests of people trying to sell you something, in this case the pharmaceutical industry. So if, for example, you have 1,000 people in a trial that didn't have the vaccine versus 1,000 people that did, in the placebo group, in the dummy group, you may have 2 people dying, and in the intervention group, you may have just 1 person dying. And that's a reduction of 50%. 1/2 is a 50% relative risk reduction. But actually, you've only saved 1 life out of 1,000. So the absolute risk reduction is only 1 in 1,000. It's a big difference. The guidance has been for many years that we must always use absolute risk reduction in conversations with patients, not just relative risk reduction alone. Otherwise, it's considered unethical.
The accusation, Pfizer's relative risk figure of 95% efficacy, when the absolute risk was a mere 0.84%.
So we were basically sold on something that ultimately, in retrospect now, was very, very misleading.
Okay, and so when it's both, okay, you have to give like 1 vaccine, or for every 1,000 vaccines you give, you save maybe 1 life. Once you look at the actual numbers, and I'm a numbers guy, man. I had a 97 on my Cal 2 final. The stuff that I look at, because that's the stuff that's important. And when we've had changes in the reporting methodology over...
The VAERS hasn't changed, so that's been in place since the 90s. So that hasn't changed.
I agree, but what I'm saying is the way the trials were run, and then the efficacy that was based.
The trials were different, but I would flip it. And again, since you're a scientist, I think we have to confront with objective sort of estimates in a pandemic, particularly in March of 20, when you're seeing these vast numbers of fatalities in your mother's age group. My mother's age group. So when you see these vast fatalities, so both administrations, the Trump administration and the Biden administration, both sides of the aisle agreed.
Voted for Obama twice, Trump once, didn't vote at all in 2020 because I don't favor one credibly accused pedophile over another.
To accelerate. Why? Because of the mortality, right? So then
I think they did it for money. I mean, there's not really any efficacious benefit when you actually look at the historical science.
So we got to call that. It was effective in every study. UT Southwestern was one of the biggest participants. Nobel-winning academia.
Are they captive to... so this is my thing.
Yes.
That AHRQ study that I quoted in there, that was Lazarus et al. 2011. And so the MIT scientists that were studying in Boston, they took an HMO and they tracked the individual vaccine doses.
But as a scientist,
so I'm just... Can you hear me out? I mean,
except that you're providing a specious argument on somebody makes a mistake or there's an error a decade before. And then you estimate that error continues in a different topic with a different team, with a different product, with a different...
The same leadership at the CDC?
No, it's not. So the director is Walensky. Before that it was Redfield. Before that it was Murthy. Before that it was Gerberding.
Different faces that say the same thing and support the same general goal.
Now different faces and different people. See, again,
it hasn't changed. There were 1,200. Hold on. It is. Yeah, absolutely. 1,200. Hold on. 1,223 deaths within the first 75 days, per Pfizer's own reporting, per their own post-market analysis, which was released in February 28th of 2021, was available to you in April of 2021. It didn't become available to me until May of 2022.
So the average.
Red flags should have been raised when the FDA locked away Pfizer's trial data for 75 years while the vaccines were being rolled out. A US court finally ordered their release, and the initial disclosures are alarming. Alexandra Latipova is one of a group of experts who studied the documents. Among her shocking allegations are these.
Pfizer skipped major categories of safety testing altogether. The toxicity of the COVID-19 vaccine's mRNA active ingredient was never studied. The FDA and Pfizer knew about major toxicities associated with gene therapy class of medicines. The CDC, FDA, and Pfizer lied about vaccine staying in the injection site. My examination of leaked Moderna documents also revealed that vaccine-induced antibody-enhanced disease was identified as a serious risk.
Okay.
The average length of life in the U.S. was 78. Mom's 75. There's 1,200 deaths, particularly in that Medicare.
Within 15 days
of
but that's not the only
you're
people.
a scientist. You understand.
I'm saying within 15 days, that's an anomaly.
If I line up 1,000 people at the mall,
okay,
and I thump everybody in the left earlobe,
okay,
so I line them up, just completely whoever's there. You're a scientist.
Yep.
I line up 1,000 people. I thump them in the left earlobe.
Okay.
4 people have a stroke. 3 people have a heart attack. Is it because I thumped them in the left in the next week? So there's 9 people out of 1,000. Especially, let's say they're aged. Let's say they're all walking the mall, and they're 60 to 85. So is it because I thumped them in the earlobe? Because that's what happened.
Okay.
I mean, within 12 days.
Let me respond.
And they have risk factors. All those 1,000 people have risk factors.
Let's respond to that then. Should we be thumping people in the ear that have risk factors? That's what y'all need to think about, and you didn't.
Because you would have to agree as a scientist, an ear thump isn't causative. Because in no other cohort
we're not talking about an ear thump, though.
But we are.
We are?
Because we are.
I mean,
because that mRNA is not shown for that stroke increase in any age cohort. It's just not.
Okay. I disagree with that, and I've got data to present.
You don't. In the data for the double-blind studies showed that was not a risk factor.
I mean,
that's the double-blind studies. As a scientist, you know that's what matters.
That's the only
not
ones
anecdotal,
that matter.
not like a perception.
Not relative risk reduction.
That's we're talking double blinds.
Please don't leave. I want to talk to you for a minute.
Sure.
So, willing to look at your data if you give me the same commitment that you'll look at the data that I provide.
I will, but how? Let me just preface it with how much of pharma is into funding of our scientific research in this country. We have a captive. So here was my point that I was going to make about the AHRQ study. All right. So those scientists at the AHRQ called the CDC, and in their report. You heard what was said then, so you've heard of this. So in their report, they said the CDC contacts responsible for final evaluation of the data didn't respond to multiple attempts to proceed. Okay, and so at the AHRQ or at MIT, which is who it was, MIT data scientists, they heard that and they said, well, on to the next study. Mm-hmm. They're the oversight. They're who Congress relies on. They're who then that trickles down to you guys to rely on. But hold on. If another group of the CDC scientists is in a similar time frame saying, hey, we've got problems here and it's becoming the norm, not the exception.
I don't take that as evidence. So a norm versus the exception.
That they're doing things that are...
Yeah, I don't think you have evidence.
So the letter on U.S. right to know is not real?
Do you work someplace? You have a job, I'm assuming?
Business owner, yeah.
So if you're a business owner, other business owners make a mistake, do we paint you with that brush from a decade ago? Like that doesn't make sense.
But we're not
scientifically objective.
So why why try to conceal the data for 75 years?
75 years.
The FDA sued on behalf of Pfizer to withhold all of Pfizer's data for 75 years.
So Pfizer's data is open record
now because it was ordered by a judge, and that's the only reason we got it.
As a business owner, they were concerned. I happen to not believe this, and I think the feds agree that if the feds are going to fund the research, that is not proprietary to the manufacturer, but it's the taxpayers. And the feds agreed, so it happened.
Informed consent is the law.
Sure, and we
Okay.
provided it.
I mean,
TMS.
when you didn't buy, so
TMS.
okay, you did.
Yeah, sure did.
Okay, how'd that
Pre
go?
and post.
How'd that go?
Well, we delivered it to every person that we vaccinated, without exception.
Okay.
Without exception.
So that's the thing is she got
that's informed consent
she
from you.
had the vaccine 3 weeks after this report was published to Pfizer, and it was available to regulators. And so I have a hard time believing that she would have felt the same level of confidence relative to safe and effective if she'd known that 1,223 people of different age groups died within 15 days of receiving that vaccine.
What was the cohort that died 15 days before, right? Like, see, again, we're trying to understand.
I don't disagree with you.
We're trying to
but we're
understand.
not talking about.
And it's not
We're
causative.
not talking about.
It doesn't make sense.
If
you understand the mRNA piece.
It absolutely doesn't make sense. You're right. It
Yeah.
does not make sense why we would try a dangerous biological product that's never before been used in humans.
Because there were people dying, and it was a global pandemic.
Okay,
and
well,
there were
when-
bodies stacked up, and this prevented
didn't see
those
that.
deaths. Sure you did.
Well,
Go Google it and
I mean, I could Google it.
go look at all of the New York.
I mean, with due
graves that had
respect,
to be
I think
dug.
it's a matter that's going to have to be settled in court, and we can let's just wait until
We'll have to agree that.
Yeah. Let's just agree to disagree for now.
I think that's right.
And that's fine. I got no dog in this fight aside from knowing that something happened to my mom 5 days after she got something that y'all told her to get.
We talk about this all the time
And
too,
that's
with the vaccine, and then COVID in general. So people will test positive for COVID, and then they are in a car wreck 3 days later.
Yeah.
Did they die with COVID or because of COVID?
Yeah, I mean, and that's a completely.
Ascertainment bias, right?
I don't
So
know.
we're trying
What that
to
is
understand.
completely irrelevant.
No, it's not, because they had
what we're
COVID.
talking.
Did it-
Okay, but
did it
who
cause
reported
a
that?
neurological-
The
who
doctor.
reported
The doctor reported that was a post-vaccination mortality. No, the doctor didn't report shit because they don't do it at all, man. I mean, they won't do it. I asked
They
them
have.
They have to. You're right. They should, but they won't.
No, they have.
Oh, they have. Okay. In cases when what happens?
Like the
Death.
myocarditis.
Death.
Yeah.
Myocarditis. Yeah. So.
Which the myocarditis rate, if you're into rates, which is what
Yeah.
matters.
Okay. So
It
how many
matters.
people
So
went?
the rate.
How many people
so the
went to the hospital
myocarditis
after this happened?
Rate. Well, again, what are we talking about? Are we talking about 80-year-olds? A lot of them. Are we talking about 15-year-olds? None of them. Like it matters.
None of them? Real, not rare? There's thousands.
Yeah, very, very rare.
Very rare. I mean, they say they're not rare. I say they're not rare.
Yeah, well,
Thousands of them.
numerically, you're being disingenuous.
I don't think so. I mean, just because this was the largest vaccination campaign ever, right?
No, not as big as polio, but it's okay.
This wasn't as big as polio?
No, because polio, probably 97% of Americans, and this vaccinated about 60 total.
Okay, yeah, I agree.
So it's not even close.
I'm glad. Right, but what was the
By the way-
population numbers then?
Well, again, we're
versus
talking
now?
about rates, not numbers.
I said campaign. I meant numbers. Gross.
Yeah, but rates is what really matters.
Right. Well, we didn't trust this because it didn't make sense from the beginning. That's why. I mean, there were questions the whole way through. Science that was established was just changing on a whim without an explanation being offered, and I've got proof of that.
Science changing on a whim without an explanation.
Yeah.
The science did change, but it had lots of explanations. Again, it's complex with an mRNA translation for a prion protein for recognition for the immune system. Like, that's complex, you know.
Right.
But,
and
it
so
doesn't
is
make it invalid.
it doesn't necessarily, but
the studies that were performed
hold on.
showed its efficacy,
Is a
and
part-
that's
Is a part of the
irrefutable.
informed consent you provided to people the ethical question of whether or not it's playing God to. So you laugh when somebody acknowledges the supreme being?
It was voluntary. I acknowledge the supreme being. It's not playing God. It's the application of a scientific method. So are we just going to allow that the creator, we don't take medicine or we don't do anything
never said that.
life-saving? Well, sure,
But
that's
this isn't
That's the
life-saving.
same argument journey.
Okay, but what I'm saying is if
It's
the
not playing
data,
God.
if
It's,
the,
preventive healthcare.
Okay, so why this is you can't really call that.
Sure.
You can't call it palliative. You can't call it. I got a hard time buying
1.3 million deaths, and it saved about 4 million.
I mean,
so that's the science. That's the numerical.
According to what?
According to the studies,
the relative risk reduction.
Blind studies.
The relative risk reduction. So who's Dr. Asim Malhotra? Have you heard of him?
So have you heard of, Francis Watson?
I mean, so,
have you heard of?
Oh, hold on. What I'm saying is,
what I'm saying is we can do small examples, and you're going to find a chink in the armor of the scientific method and the process. I'm going to keep giving you the results of double-blind studies, and so I don't know how we're going to resolve that.
So how we resolve that is ultimately, like I said, with probably a civil lawsuit.
And I think
because there is a duty.
Everybody would welcome it, because then you get to present more of the data.
Exactly. And so as a doctor, right, there was a huge incentive to not report, right?
No incentive.
There was no incentive?
None.
Okay.
Tell me the incentive. What is it?
What's the incentive to go along with this?
What? Yeah.
Okay.
What's the incentive?
There's none?
Zero.
Okay.
Is there a monetary incentive for the doctor to decide either way?
Do you think so?
None.
No? Okay.
In fact, probably a disincentive.
Okay, so what? Explain my experience.
I think it's qualitative. I think you have a sample size of 1, and I think for all of us, a sample size of 1 is impactful.
When the request is made, and so here's what I have in common with Dr. Malhotra is it happened to someone close to me.
Sure.
And so with that experience, I wasn't willing to let fear mean that I didn't say what I felt was true. And I feel like...
Interesting. As a scientist, you used a lot of interesting terminology. What I felt was true, fear.
Yeah, what I believe.
But usually, belief.
Based on evidence, right? Because evidence is
based on similar experience that you find compelling.
No, evidence is what drives belief. Okay, faith is the assurance of the heart and the adequacy of the evidence. It's not blind. It's not blind.
Is the assurance of things hoped for and the evidence of things not seen, right? But
not necessarily not seen.
So I would just say that what is important in the things that we provide as an intervention are things that are going to be counterintuitive to you with a sample size of 1, with something that you're emotionally invested in.
You're okay, again, just because I'm emotionally invested in it doesn't mean that my thinking is not rational.
But it does
you can't dismiss my experience.
It does mean that every time I give you something that I can provide as scientific fact, you want to refute with another sample size of a quote, but you don't have a study that could refute it. And by the way, the reason that we did this is because of the multiple studies that weren't refuted about the success of an mRNA vaccine for COVID.
Okay, conducted by people that are...
UT Southwestern, Caltech.
People that didn't say anything when the CDC stopped answering their phone calls, and they were getting 1 in 40 vaccine doses, potentially causing permanent injuries to recipients.
That did not happen.
Read the study.
That did not happen.
I'll pull it up right now.
That did not happen.
Okay. You want to say that on the record? 1 in 40 is what that study cites.
Well, and did you say permanent disability?
I said it's giving them permanent injury.
That did not happen.
That's what the study says. That's what their preliminary analysis said, and the CDC...
A permanent injury, 1 in 40.
1 in 40, fewer than 1% of vaccine injuries being reported to VAERS based on what they were tracking.
That's just not right.
Well, so their data may be wrong now. So that's what you're arguing with.
No,
you're arguing with data.
I'm arguing that the other studies for all of these institutions
are underreported.
Don't show that. No, they're not underreporting. In fact, they're over-reporting.
Okay.
Because again, what I mentioned, redness and pain at the site of injection, which happens with all vaccines. Okay. That's a legal VAERS report. And it still wasn't 1 in 40.
Well, Again, agree to disagree, but if you had told them about the ethical question, if you told them about the 1,223
There wasn't an
deaths,
ethical question.
there's not an ethical question with the technology in general with CRISPR?
No.
There's
Now,
not?
this isn't CRISPR.
Okay.
You understand the difference.
I absolutely understand.
Then why did you just say it?
Because
what are we doing?
It involves the same type of transcription.
It doesn't. It doesn't. So the
Okay, again,
not similar.
without the science in front of us, I mean, it's not really possible to argue semantics. But
it's not semantics. The difference between CRISPR and mRNA technology is not semantics.
so CRISPR doesn't utilize mRNA transcriptase.
I'm saying that the CRISPR, in the way that you're discussing, mRNA transfer is part of the CRISPR technology in general.
Okay.
But CRISPR,
You can't-
using your own genetic profile to change a gene to turn a codon on and off, you understand that? That's not what the vaccine did.
Okay, so the spike protein, which was produced, right, is shown by the American Heart Association in July last year to be toxic to our bodies.
It's not.
Well, why did the American Heart Association, who my sister is the international editor for, why did they say that?
It's not.
Okay,
It's
well,
not.
The authority in the
They're
scientific
not.
field
Talked
disagrees.
about this for hours.
Good.
Yeah, we're not getting there.
Appreciate your time, man.
My name is Joe. What's your name? I didn't hear you.
Stephen.
Stephen, I want to hug you.
Thanks.
And I want to validate everything you're saying. I'm so sorry. Everything you're saying is true. It's my daughter's an emergency room nurse,
My sister's an emergency room nurse.
and she refused to take it.
Oh.
She knew someone who took it. A man who was completely healthy.
Your name is Joan, you said?
Yes.
My sister Joan is was an ICU nurse. She got out of the field.
And he had a stroke too. What you're saying is right. You can talk to these people all you want because you know what the main thing is? Money. And I'm
It is,
so sorry
but-
for your mom.
but
I wish she
ultimately-
didn't take it.
I wish not as well. I begged her not to.
I did not 71. I would not take it.
He's gonna let you know.
Okay. I'm just gonna sit down here.
Well, good morning. We are back today at the courthouse on the square, which was built in 1896. And so today is the county's 177th birthday, and we thought it would be great to come back home. And so I think that was it was fun to be able to come over here this morning and be in this courtroom, which has been going strong since 1896. And it's good to remember our past. And we're going to do a proclamation today, and we're going to have a birthday party and a birthday cake. You can't have a birthday party without a birthday cake. So
this birthday is a marker. You look back and then you look forward. And when you look forward, you see your potential because of everything that has been built before you came on the scene. And I put them in their place in a new way today because they will have to have the anointing of the living God to be able to do what is ahead of them. So we just want to recognize those and honor those who have gone before because they laid the foundation. And the words the Lord has given me today are about foundation and who is going to build. Matthew 7:24 and 25. Those people who are listening to me and those people who hear what I say and live according to my teachings, you are like a wise man and a woman who built his house on a rock, on a firm foundation. When storms hit, rain pounded down and waters rose, levees broke and winds beat all the walls of that house. But the house did not fall because it was built upon the rock. Now, those of you who are listening and do not hear, you're like a fool who builds a house on sand. For when a storm comes to his house, what will happen is this: the rain will fall, the waters will rise, the wind will blow, and his house will collapse with a great crash. But those who build with God and those who build with godly principles will have the Eternal's blessing on their house. So Psalm 127 verse 1 says, unless the Eternal builds the house, those who labor to raise it will have worked for nothing. And unless the Eternal stands watch over the city and the county, those who guard it have wasted their time.
Today, and we're going to have a birthday party and a birthday cake. You can't have a birthday party without a birthday cake. So to build with the anointing of the Holy Spirit. It is a time for celebration, but it's also a time for reflection. It's a time for fresh commitment and empowering. So today, I release a new anointing to build this county, because you've got a lot more over here than you did back there. And a birthday cake. You can't have a birthday party without a birthday cake.